still yet happen, but we have remained vigilant and we will remain vigilant. I know New Brunswickers have been quite determined, and I encourage that determination to do what is required to limit the spread of this virus. It remains necessary that we all continue to do the things that we have been doing by wearing our masks, physically distancing, washing our hands in the weeks and months ahead. And again, I commend everybody who has been doing their part. Significant sacrifices made all around this province on many different levels, and I do commend everyone. I am very proud of the work that New Brunswickers have been doing. Aujourd'hui, j'annonce qu'il y a 4 nouveaux cas confirmés du COVID-19 au Nouveau-Brunswick. Il y a 3 nouveaux cas de la zone 4, soit la région d'Edmundston. Une personne âgée entre 20 et 29 ans, une personne âgée entre 30 et 39 ans, une personne âgée entre 40 et 49 ans. Il y a un nouveau cas dans la zone 2 qui comprend les comtés de Saint John, Kings et Charlotte, soit une personne âgée de 30 à 39 ans. Il y a présentement 75 cas actifs dans la province et 4 d'entre eux sont présentement hospitalisés, dont 3 aux soins intensifs. Je vous demande à nouveau d'accompagner toutes ces personnes dans vos pensées aujourd'hui et leurs familles. Today, there are 4 new confirmed cases of COVID-19 in the province. In Zone 4, which is the Edmundston area, there are 3 new cases. 1 individual aged 20 to 29, 1 individual aged 30 to 39, 1 individual aged 40 to 49. There's 1 new case in Zone 2, which is the St. John, Kings, and Charlotte counties, an individual aged 30 to 39. We now have 75 active cases in the province, with 4 individuals currently in the hospital, 3 of whom require intensive care. And I ask you again to keep all of these people in your thoughts today, as well as their families. It is exciting to have every region of New Brunswick at the yellow level once again, but please remember, yellow means caution. Everyone will still have to take great care to prevent the spread of COVID-19 so that we can maintain this enviable record. We know that cases of travel-related COVID-19 cases, as well as some community transmission that can slip in across our borders, as there is community transmission outside our borders, is very, very important that everybody take the precautions necessary to prevent the spread. Keeping New Brunswick in the yellow phase will require ongoing commitment by all New Brunswickers to wear masks in public places, maintain 2 meters of physical distance from one another at all times, and stay at home when you do not feel well and get tested if you have any symptoms of COVID-19. It is vitally important to limit your number of close contacts and to be consistent about whom you are in close contact with. And I think with all of our experience now, having gone through many outbreaks in the last several months in different zones, the learnings that we can take away right now that we can provide you with so that we can all stay in the yellow phase of recovery and through the holiday season, because we know that people will travel, there will be gatherings, and we really don't want that to turn into a spike in the number of cases in early January or mid-January. We know that in the US they're seeing a spike in cases after the American Thanksgiving celebrations happened. We don't want to see that here with our holiday celebrations. So to keep your close contacts at a minimal number and make sure that they're consistent. So at the yellow level, informal indoor gatherings of up to 20 people are permitted, but it is important that these be limited to a consistent circle of close family and friends. Everyone should aim to keep their social contacts, the people you spend time with without wearing a mask or maintaining physical distance, to no more than 20 individuals. And just because we're saying 20, the fewer the better, actually. So this is what will slow the spread of the virus. It will make it easier to contact close contacts when outbreaks happen, and will help keep outbreaks short and small as small as possible, and hopefully prevent zones from going back into orange. Il est cependant très important de ne permettre qu'au même cercle de membres de la famille et d'amis proches de prendre part à ces rassemblements. Chaque citoyen doit essayer de ne pas avoir plus de 20 contacts sociaux étroits, soit les personnes qui côtoient sans porter de masque ou sans de maintenir une distance d'au moins 2 mètres d'elles. In recent outbreaks, we have seen confirmed cases with dozens of close contacts, and each of these had to go into self-isolation for 2 weeks to keep the disease from spreading. When you multiply that out, you can see how quickly we had more than 2,000 people in New Brunswick in self-isolation at one point. I strongly suggest that everyone make a list of their close contacts and aim to keep it to a steady 20 for 2020. And we will be having some information on our website around this. So if you think about your steady 20, those are the people that you relate to most closely. Stick with that and support your steady 20, and they will support you. If we all do these things, we stand a better chance of limiting the impact of future outbreaks of COVID-19. And we have a lot of experience with these outbreaks now, so we really have tracked the progress, we've tracked the transmission patterns, and we've tracked all the things that we're feeding into the spread of the virus. There will be more outbreaks. Vaccines are on the way, which is also a good news story. And with the first New Brunswickers will be inoculated in the next week. This is an exciting development that we give hope to everyone at a time when we could all use some hope. It will be several months before the vaccines for COVID-19 are widely available for the general public. So the initial stages of the rollout and the plan, Greg MacCallum will be detailing those shortly. And until that happens, we will continually be challenged to keep the disease at bay. And I think that will be the biggest challenge over the course of the next 9 to 12 months, trying to keep outbreaks small, keeping them under control and contained while the vaccine rollout happens in our prioritized lists of individuals and groups of individuals. It remains vital that we all stay on our guard to protect ourselves, our friends, and our families from COVID-19. Especially over the holiday season, it will be important to keep doing the things that prevent the spread of this disease, wearing a mask, maintaining physical distance, and keeping your close contacts to your steady 20. We have much to celebrate this year as this year draws to a close, and many will think of 2020 as a very challenging year, a year of unexpected situations that have been, again, a challenge for all New Brunswickers. But I think we have met that challenge of this deadly disease by responding with courage, determination, caring, and kindness. I owe so much to all of you in this year of such challenges. Your efforts have been what has helped us succeed and will continue to help us succeed in our journey through this pandemic. Je vois cependant cette année comme le moment où les citoyens du Nouveau-Brunswick ont dû faire face à une maladie mortelle et ont relevé le défi avec courage, détermination, bienveillance et gentillesse. Je vous dois tant à chacun de vous. C'est grâce à vos efforts si nous avons connu du succès et continuerons sur la même voie pour nous sortir de cette pandémie. Thank you very much.
Good afternoon. Over the last few weeks, residents of Zone 2, the St. John region, have worked hard to get back to the yellow level of recovery. I want to thank everyone who has done their part by following the rules, by staying within their single household bubble, and wearing a mask in all public spaces. I know it has not been easy, but your dedication has paid off. I am pleased to say we are following the recommendation of Public Health in Zone 2 will return to the yellow level as of midnight tonight. This is good news. It means the whole province will be back in yellow. We are also receiving the exciting news this week that a vaccine has been approved and will soon be able to start providing it to our most vulnerable populations. We are developing a detailed vaccine plan for New Brunswick. There are priority groups who will receive this first round of vaccine next week. These groups include long-term care residents and staff from the provincial rapid outbreak management teams who respond to COVID-19 outbreaks, and you'll know that we refer to them as our prompt teams. Extramural Ambulance New Brunswick staff, healthcare workers involved in COVID units, seniors 85 and older, and First Nations nurses. This distribution plan will be carried out under the capable leadership of NB-EMO Director Greg MacCallum. He will provide more details about the plan shortly. We know that vaccinating our entire province is going to be a long process. There is light at the end of the tunnel. But until more vaccine doses are available, we must all continue to follow the rules that are in place under the yellow level. That means wearing a mask in indoor public spaces, maintaining physical distance, and practicing proper hygiene. It is also important that we keep our number of close contacts small. If we follow Dr. Russell's advice to limit our contacts to the steady 20, consistent family members and friends, we will help limit the spread of COVID-19, and public health will be able to carry out effective contact tracing. New Brunswick is leading the way by keeping our case numbers low and keeping outbreaks contained when they do happen. While we have had to transition zones to the orange level several times since our province came out of lockdown, we have been able to quickly get the situation under control every single time. New Brunswickers should be proud that we have kept our province in the yellow level as much as we have during this pandemic. Amongst other provinces and around the world, we are viewed as an example of what can be achieved when everyone works together toward a common goal. Thank you for doing your part to protect yourself, your loved ones, your friends, and your neighbors. Let's continue to be a positive example and work hard to keep all of New Brunswick yellow. Thank you. Merci.
Good afternoon, ladies and gentlemen. As has been mentioned, my name is Greg MacCallum. I'm the Director of New Brunswick Emergency Measures. And last week, I was appointed to lead the New Brunswick Immunization Task Force. Since then, I have been reviewing the preparations made to receive and distribute the COVID vaccine here in New Brunswick. And I can assure you a remarkable amount of planning has already taken place. I'm pleased to report that we are ready to receive these shipments and to distribute vaccines so that New Brunswickers can get immunized against COVID. Now, as was referenced in previous comments, and as we learned yesterday, Health Canada has approved a vaccine for COVID-19, specifically the Pfizer ultra-low temperature vaccine. This announcement follows Health Canada's very stringent approval process to ensure product safety of the vaccine. Also yesterday, New Brunswick conducted a test. It received its first shipment, a dry run, really to validate the delivery and handling process so that we can safely take receipt of the vaccine once it's been safely transported to New Brunswick. These were all successfully completed, and we do have a confirmed method and mechanisms of receiving and thereafter administering the vaccine. Now, we expect the first 1,950 doses of Pfizer's vaccine to arrive in New Brunswick in the coming days, certainly within the next week. Now, you say 1,950. We are a population here in New Brunswick of over 700,000, and that seems a small number. But I want to reassure people that it is the first step of a regular delivery schedule, which will immediately follow thereafter. Like other provinces, New Brunswick's basing its prioritization and sequencing on the work of the National Advisory Council on Immunization, their recommendations on key populations to be immunized first. And as Minister Shephard just mentioned, these include nursing home residents and staff, healthcare workers, older citizens and adults, and of course medical staff in Indigenous communities. However, with small shipments initially and logistic limitations on the first two products, it will take some time to immunize these first groups. The first shipment of product will be delivered to the Miramichi Regional Hospital, which is the site of New Brunswick's ultra-low temperature freezer that has just been installed there. That unit for the Pfizer-BioNTech vaccine is necessary, as the vaccine must be stored at minus 80 degrees Celsius. Now, Minister Shephard already spoke to the priority groupings, and I would like just to reiterate and emphasize that it's important to remember that although the first shipment is a relatively small number, it is the first step for many, first step of many for this immunization campaign. We want people to understand that it'll take much of 2021 to roll out and administer vaccines to all New Brunswickers, but they will be done safely and efficiently, and the vaccines will be brought to convenient locations for people to be able to access them. Part of the planning is recognizing and realizing that a large portion of the initial steps in this campaign will take place in winter conditions, and contingency plans for the delivery and transportation are certainly being put in place to ensure the most efficient rollout possible. So this is a very important and significant first step, this first arrival, but it's not a finish line. We'll get to the finish line, certainly. But for now, as has been mentioned, we must remain vigilant. We need to follow public health measures to protect everyone's health and safety. And even those who do become immunized early will need to continue to be vigilant and follow those same health measures to ensure that it is a safe process, a safe campaign, and that successfully completed, which it will be, all New Brunswickers can quickly get through this pandemic and be confident that this has been eradicated. Thank you very much.
Thank you, Minister Shephard, Dr. Russell, Director MacCallum. Merci, Monsieur MacCallum, Ms. Shephard, et Dr. Russell. We'll now proceed with questions from members of the media. Each member will have one question and a quick follow-up. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question et un suivi. Don't forget, please ensure your microphones are placed on mute. Voulez-vous assurer de désactiver le son de vos micros, s'il vous plaît? Laura Brown, CTV News.
Hi there, Mr. MacCallum. I apologize if you said this, but is the plan for these first initial doses of 1,950? Who will be getting those doses, and will they have to go to the Miramichi Hospital to get them?
Thank you for the question, Laura. Yes, initially this, because it's the Pfizer vaccine and because it requires such low temperature storage, it will go to the Miramichi Hospital as the first tranche of this distribution. As far as the quantity and how it will be apportioned, it will be apportioned in accordance with those priorities we've just stated. Now, I want you to understand that as this is a very recent announcement as to the exact quantities of this, we are continuing to finalize the specific numbers. But several hundred long-term care residents and their attendant staff will certainly be in the very early stages of this, as will a significant number of healthcare workers, as mentioned as part of the prompt teams, people that are working in COVID units, and folks that have a direct interface with COVID patients. So The numbers are being refined. The objective here is to ensure that we administer this to the priority groups in the most efficient way possible, and we're going to touch each of those priority groups with a portion of this first allocation.
Thank you, Director. Ms. Brown, do you have a follow-up?
Wondering if you're looking ahead at trying to secure more freezers then, or if you're looking ahead thinking we're hoping that we'll get a different vaccine that doesn't have to be held in such low temperatures.
Again, another good question, and of course, part of the planning idea is looking ahead. So absolutely we are. And I don't want anyone to be under the impression that this is the only freezer with which we will store and from which we will issue the vaccine. There is an inventory of freezers within the province, and as well, the actual shippers that the Pfizer product arrives in are in effect a dry ice freezer in which things can be stored temporarily. The biggest constraint we have right now is we will receive them at the Miramichi Hospital, and because of the nature of the ultra-frozen vaccine, the advice is from the manufacturer is not to forward transport it. So that's why we'll hold the initial clinic in Miramichi. Now, to the second part of your question, I've already partially addressed it in that, yes, there will be other freezers in other locations, but also there will be other vaccines. And the second vaccine, which is in contention and is nearing the approval process by Health Canada, the Moderna vaccine, of which many probably have heard in the media, will be coming online in the near future. Certainly, that is factored into our planning. It is much easier to transport and distribute to diverse locations, and that will be integrated into the overall distribution plan.
Thank you, Ms. Brown.
Thank you.
Travis Fortnum, Global TV.
Hello. My question is also for Mr. MacCallum. I just wanted to clarify something Laura just asked. So these initial doses that are coming out next week, to get those, you will have to go to the Miramichi Hospital, or like you said, will they be able to be shipped to where these other freezers are now?
No, the initial 1,950 doses will be administered at clinics which will be held at the Miramichi Hospital.
Mr. Fortnum, do you have a follow-up?
No, thanks.
Thank you.
Thank you.
Jean-Philippe Hugues, Radio-Canada.
Bonjour, ma question est au sujet de la zone sanitaire de la région d'Edmonton. Donc, il y a 3 nouveaux cas aujourd'hui. Le réseau Santé Vitalité a annoncé qu'il y avait une possibilité d'exposition à l'hôpital régional d'Edmonton. Moi, j'aimerais savoir qu'est-ce qu'on sait à ce sujet-là et est-ce qu'il y a du personnel hospitalier qui est infecté présentement?
Alors, on a reçu des nouvelles sur l'hôpital à Edmundston ce matin et la santé publique est en train de travailler avec Vitalité pour faire les recherches sur les cas et les contacts étroits à ce moment-ci. Alors, Vitalité a donné des directions au public pour ne pas venir pour visiter des gens qui sont hospitalisés. Et si vous avez un problème urgent, de ne pas vous présenter au département d'urgence, sauf que si c'est une urgence très, très sévère. Alors, ça, c'est les nouvelles qu'on a reçues dès que ce matin, mais encore, il y a plusieurs tests qui sont été faits. Alors, on attend encore pour les résultats pour définitivement donner plus d'informations.
Monsieur Hugues, as-tu un suivi?
Oui, on peut avoir la confirmation que du personnel hospitalier est infecté présentement dans les 3 nouveaux cas annoncés aujourd'hui.
Des employés ou des patients?
Les employés de l'hôpital.
J'ai pas de détails sur toutes les gens qui sont infectés parce qu'on attend encore pour des résultats.
Merci, Monsieur. Tom Bateman, Times and Transcript.
Oh, good afternoon. First for Director MacCallum.
C'est quelqu'un du Canada qui vient exactement de demander ce que je devais demander. Fait que...
Can you hear me?
Je confirme rien.
Peux-tu mettre ton micro? désactiver ça tout de suite. Mr. Bateman.
Hey, still here. It's always me. For Mr. MacCallum, why Miramichi? You know, it's a way for, you know, there's larger highways, larger airports in other cities. There's a relatively low case count in Miramichi. There'd be more healthcare workers in other cities. Why did you pick Miramichi for the location of this first freezer?
The decision to place this ultra-low temperature freezer at the Miramichi Hospital was made by public health authorities, and it was made based on really geographic centrality in the province. It doesn't matter when you speak about a singular location. It doesn't really matter where you place it if all you want to do is store something, but the consideration is about transporting forward from a facility that essentially is for storage. So it was placed there because it is, in the Miramichi area, it is central, relatively speaking, between the two regional health authorities, and geographically, it is also relatively central in the province. Now, one could argue that population density should be a factor in consideration here, but when you're looking at this from a logistic perspective, it's about time and distance considerations. And if you think, by way of analogy, if this would have been placed in St. John, then people would have had to travel 4 or 5 hours if they were coming from the northern part of the province. Whereas centrally, it essentially means people from anywhere in the province could get to this facility within 2 to 3 hours at the most. But I just want to underscore something I said earlier. This one freezer is not the freezer. It's not the only freezer. And this is a progressive build, and additional freezers throughout the province will facilitate a much more even and equal distribution in terms of time and distances.
Mr. Bateman, do you have a follow-up?
I do. For the health minister, Minister Shephard, I want to hear more about how this province decided on who was included in this priority list of vaccine recipients. Does it differ at all from the advice you got from the federal government? And perhaps, you know, what other candidates were not included in this initial list?
Well, I think it's important to know that this is 1,950 vaccines doses. So the priority list was derived with public health consultation at the national level and the local level. They have certainly used the federal list as a guideline, and for the most part, we're respecting it. With regards to who's not on the list, there will be more doses, there will be more rollout, and we're going to address them as we go. It's really important that we have that unity in going forward with this. It was presented to COVID cabinet. It certainly came through cabinet, but more importantly, this has been done with the recommendations, the collaboration of the federal and provincial public health teams, and that's why it was decided. Everyone will receive the vaccine between now and the time the entire province is done. And so for now, with a minimum of 1,950 doses, and the next 1,950 doses will go to the same individuals because it requires 2 vaccinations, this is where we felt the priority really needed to lie, and the opportunities that we had in the community.
Do you want to add to that?
So at the federal level, there were actually 5 organizations who contributed to the prioritization. The 5 organizations include the National Advisory Committee on Immunization, as well as the Special Advisory Committee, which I am part of. And there's some other organizations, and they all have FPT representation for the most part. One of the organizations included an Indigenous organization at the federal level. So in terms of the information that came out at the federal level, it did have input from all these organizations. organizations. And then in terms of the prioritization here in the province, again, very similar to the recommendations from NACI. So in terms of the logistics and timing and all of that, every province has within their jurisdiction the ability to make arrangements that suit their needs logistically. So that's why we're rolling out with the help of Greg MacCallum leading us with the logistics side of things. And there are 7 vaccines that will be rolled out eventually. The first 2 are the ones that are more complex in terms of needing to be held at lower temperatures, but the ones after that have to be held at vaccine temperatures that are what we see normally.
Thank you, folks.
Thank you.
Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for whoever feels comfortable answering it. What can you tell us about potential side effects of the Pfizer vaccine, and what precautions are you taking to prepare New Brunswickers for certain reactions?
So on the Special Advisory Committee phone calls, we are being given advice on all the different vaccines, but this information is also being provided to deputy ministers and the premiers, et cetera. So what we will probably be doing is working with communications to make sure that once we have all that information, that it is communicated in a way that the population can understand as they receive the information. There are criteria that you have to meet to get the vaccine. The most common side effects would be the site of the injection, and there are others, but the issue around all of these new vaccines is that because they're new, some of them are a new technology even, we are committed to a very strong surveillance system to make sure that we keep track of any adverse events. And this will be very, very important as we move through the rollout of all of the vaccines.
Thank you, Doctor. Ms. Hogarth, do you have a follow-up?
I do, thank you, Bruce. Will New Brunswickers who've been fully vaccinated for COVID-19 still be required to follow COVID-19 guidelines?
So that is also something we've been discussing at the national level, and as of right now, because we don't know how long the immunity lasts, we don't know if people will be shedding the virus and transmitting to others. As of right now, we will maintain the same advice with respect to following public health measures after the vaccine is given, but we will continue to monitor that situation. We will take into account any new information that we get on that, and if we will be making changes at a later point in time, then we will look at that.
Thank you, Doctor. Nathan DeLong, Miramichi Leader.
Good afternoon. My question is for Dr. Russell or Director MacCallum. What can you tell us about the security of the vaccine and what precautions or steps will be taken to secure the storage?
Yes, thank you for the question. Security of the vaccine is always a consideration, as it is, to use the words of our Prime Minister, a precious commodity at this point. Again, another good reason why this initial shipment is going to a regional hospital, and it's specifically going to the pharmaceutical section of the regional hospital, which is specifically responsible for security and well apportioned with security measures as part of that facility. So the dimensions of security when it's in location are well addressed by the security plans at the hospital. Now, to speak to security while it's in transport, the Pfizer vaccine will be delivered under arrangements being already made, by Pfizer themselves. So this vaccine will be under positive and secure control from its point of manufacturing, literally to the doorstep of the facility to which it's being delivered. And all the appropriate security measures are being taken to ensure that that is done safely and securely.
Thank you, Director. Mr. DeLong, do you have a follow-up today?
Yes, I do. What information can you tell us about the plan that you've developed for administering the vaccine? Like, how do you expect to go about administering it?
By administering it, do you mean actually conducting clinics?
Yeah, what will those look like?
Well, there is, as you could appreciate, a very deliberate approach to planning an immunization clinic. But a large part of the delivery of this vaccine, the administering the vaccine to individuals, will be done in healthcare settings. In this initial, as I've already described, scenario where at the Miramichi Regional Hospital, the initial clinics will be run. And you will see that expand to be inclusive of other regional hospitals as well. And that is, again, something that is driven by the nature of the vaccine itself and the restrictions on its transportability. But as the days go on, we receive additional vaccines. They're easier to transport. This will then be expanded, the distribution network, to outside of the regional hospitals, to regional facilities, and ultimately, we'll see a situation where pharmacists will be administering these as well.
Thank you. Thank you, Mr. DeLong. Alexandre Boudreau, l'Acadie Nouvelle.
Oui, bonjour. Ma question est pour la docteur Russell ou le directeur MacCallum, dépendamment qui est en contact de répondre. Je me demande est-ce que c'est la santé publique qui va choisir quelles personnes de quel groupe pourront être vaccinées ou est-ce que ce sera premier arrivé, premier servi pour les gens qui appartiennent au groupe à risque?
Alors, vous voulez savoir, c'était qui a décidé quel groupe serait être de priorité et quand et où ils seront vaccinés? C'est ça la question?
Non, pardon, je veux savoir, dans le fond, parmi les groupes, désolé, parmi les groupes qui ont été désignés comme à risque, comme prioritaires, est-ce que c'est la santé publique qui va choisir quelles personnes parmi ces groupes-là pourront être vaccinées en premier ou est-ce que les personnes qui appartiennent à ces groupes-là pourront se présenter à l'hôpital, puis dans le fond, faire la ligne, puis se faire vacciner? Est-ce que c'est vous qui choisissez ou c'est les personnes de ces groupes-là qui choisissent?
Les décisions, initialement, c'était fait au niveau national, mais c'était avec des informations de 5 différents groupes qui participaient. Et il y avait de la représentation de chaque province et territoire. Au niveau du provincial, ici, l'endroit, c'était décidé par les réseaux. Et en plus, à cause de c'est le vaccin comme tel qui décide l'endroit après, parce qu'on ne peut pas vraiment le transporter après que c'était livré au Miramichi. Alors, au niveau de les gens qui vont l'avoir, les priorités vont être celles qu'on a déjà décrites. C'est les travailleurs de santé qui vont travailler avec des patients de COVID. Ça sera les gens qui sont dans les foyers de soins et les gens qui travaillent avec les gens dans les foyers de soins. Mais encore, si les gens veulent voyager au Miramichi pour recevoir le vaccin qui sont dans les listes comme ça, c'est planifié avec les réseaux à ce moment-ci parce que c'est beaucoup de gens qui travaillent pour les réseaux et aussi avec le développement social. Alors, c'est c'est la santé publique qui travaille en collaboration avec les groupes comme les réseaux et le développement social, le département de développement social.
M. Boudreau, as-tu un suivi?
Oui, donc peut-être juste pour clarifier, s'il y a des personnes qui n'ont pas nécessairement été contactées par la santé publique pour leur dire qu'elles peuvent recevoir le vaccin, mais qui sont par exemple des travailleurs de la santé ou des travailleurs des foyers de soins, ces personnes-là peuvent se rendre à l'hôpital de Miramichi pour peut-être avoir le vaccin. C'est bien ça?
Non, ça serait quelque chose qui sera communiqué à l'interne avec nos partenaires, avec les réseaux et les gens qui sont avec les foyers de soins dans cet endroit. Alors, c'est vraiment de la communication directe avec les gens. Parce que ça, c'est la première. On sait que 1950, c'est pas beaucoup. Alors, on va avoir d'autres livraisons de d'autres vaccins du même sorte. et après ça, ça va dérouler une autre sorte. Après ça, ça va dérouler une autre sorte. Alors, d'ici à la fin j'espère, la fin de 2021, au niveau national, ils disent à la fin de septembre, on sera tous vaccinés. Mais on va voir comment ça va dérouler. Mais ça, c'est la planification qui a été déjà faite. C'est ça qu'on essaye de faire.
D'accord. Oui, c'est juste une clarification. Je peux savoir un follow-up aussi, Bruce?
C'est quoi ta clarification demandée?
Je vais demander juste une clarification à ma première question, mais je voudrais aussi savoir comment vous allez vérifier l'identité des personnes qui vont recevoir le vaccin quand, par exemple, ça sera disponible à plus de groupes à risque. Donc, comment vous allez faire la vérification que c'est bien les personnes qui appartiennent à ces groupes-là?
Ça a été déterminé, comme je dis, au niveau national, avec 5 groupes qui ont donné de l'information là-dessus. Et on a pris toutes les informations sur les gens qui sont à risque et on a déterminé les gens ici au Brunswick qui sont dans les groupes. Mais on voit que, parce que le nombre de doses qui sont distribuées maintenant, ça va être des tout petits nombres de doses. Alors, au fur et à mesure qu'on en reçoit d'autres, toutes les populations à risque vont être faites au premier, puis après ça, le reste de la population va être fait plus tard.
Si vous d'autres, tu peux m'envoyer un courriel pour ça aussi. Héloïse Rodriguez-Quilibage, Radio-Canada.
Oui, bonjour. J'aimerais avoir une clarification pour l'échéancier. Quand est-ce que vous pensez que le public en général, donc pas les travailleurs de la santé, mais le public, pourra commencer à recevoir le vaccin au Nouveau-Brunswick?
Les détails sur la planification sur le public en général, l'information qu'on a reçue, c'est ça peut-être environ le mois de juillet, mais ça peut changer au fur et à mesure qu'on a plus de vaccins. Alors, ça dépend sur le nombre de vaccins qui sont acceptés par la Santé Canada et le nombre de doses qu'on va recevoir. S'il n'y a pas de problème, parce qu'il y a des choses qu'on ne peut pas prévoir, mais le plan à ce moment-ci, d'ici à la fin de 2021 ou d'ici à la fin de mois de septembre, on sera tous vaccinés si tout va bien.
Héloïse, as-tu un suivi?
Oui, merci. Puisque le vaccin ne peut pas être déplacé, est-ce que vous avez un plan pour déplacer, par exemple, les résidents des centres de soins, les autres endroits dans la province? C'est quoi votre plan pour amener les gens au vaccin?
I'm not sure I heard the last part of the question, but it was along the lines of, do we have plans to move nursing home residents to the vaccination sites?
Yeah, what is your plan exactly? How are you planning to bring people to the vaccine?
Well, we're working very closely, as you can imagine, with a lot of partners here. And the owners-operators of nursing homes, the Department of Social Development, they all inform such decisions. And where it is logistically simple and where nursing home residents or residents of long-term care facilities are ambulatory and able to come to a clinic designated in a regional hospital in close proximity, that approach will be taken. But make no mistake, there is, as we progress through this, there is every intention to bring the vaccination to people who are in long-term care facilities so that they don't have to travel. Now, this is a multi-layered and quite complex undertaking here, but it is, of course, recognized from the outset here that we are going to minimize transportation of people and certainly avoid any risk of moving people around unnecessarily.
Thank you. Merci beaucoup, Héloïse. Bobby Jean McKinnon, CBC.
Yes, hello. Sorry, so just to follow up on that, Mr. MacCallum, you said earlier that the first 1950 vaccines would have to be administered at the Miramichi Hospital. So how many nursing home residents will be able to travel there to receive the vaccine? And how long before you expect to get more freezers to be able to reach more nursing home residents?
Two-part question. First part, in terms of the number of residents in long-term care facilities, we are expecting in the vicinity of 400 people that are residents in those facilities. And again, it's about proximity and ease of being able to transport people to them. Now, there are other seniors who are not living in long-term care facilities who do have the ability and will be invited to attend that clinic as well.
Ms. McKinnon, do you have the quickest follow-up?
Oh, sorry, I guess the other half of that was how long before you expect to have more freezers to be able to reach more nursing home residents?
That is currently very much being worked on, and there is not a shortage of freezers, and I would remind everybody as well that this vaccine does come in dry ice packs which can last several days as long as you continue to replenish the dry ice. So to answer your question, the emplacement of freezers in other locations in the province and identifying those that are available already in place is happening now. At the outset of my prepared notes, I stated that we are ready to receive vaccine going forward now. So there is not a shortage of freezers. There will be some administrative movement of things to make sure they're in optimal locations, but that is already underway.
Thank you, Ms. McKinnon. Erica Butler, CHMA, Sackville.
Oh, thanks very much. This is for Mr. MacCallum. I apologize if you've already answered this in French or English. But I'm wondering, will people be traveling from around the province to the Miramichi Hospital to get some of these initial 1,950 doses, or will these doses all be going to that immediate region?
There will be people who will be traveling, but they will be healthcare workers. And when you work with a number like 1,950, you go for some quick successes in terms of being able to immunize those priority groups that are immediately available and accessible, but you also expand the offering of availability to become immunized in this one first shipment to healthcare workers coming from such organizations as the lab at the Dumont Hospital, for example, COVID units in other hospitals. So within the capacity of the number of doses available and within the availability of some health care workers, they will have the option to travel. I would hasten to add at the end of that, or if they choose to wait, there are, of course, regularized subsequent deliveries, which will likely be in a location closer to them.
Ms. Butler, do you have a follow-up?
Yeah, just a quick one. It's a 2-dose vaccine, so I'm guessing there's going to be a matching shipment to these 1,950 doses coming within December. And I guess I'm wondering, so yeah, will those also be going to the Miramichi Hospital, or are you planning to split those 1,950 that are at Miramichi? Do you know what I'm getting at here? Will you be sending the second shipment that's coming in December also to Miramichi, or will that be going to another freezer somewhere else?
We have to assure that when you administer the first dose of the Pfizer vaccine, that you have an absolutely reliable second dose to be administered 21 days later. To that end, the first shipment, which is coming in of 1,950 doses, will be administered because we have absolute certainty that the sufficient quantity for the second dose will arrive very shortly thereafter and will be placed in the ultra-low temperature freezer held in reserve to inoculate that first 1,950 recipients. And that will be the plan going forward, where we will maintain a reserve in the event that there are supply chain interruptions or weather delays or whatever it might be, so that we can be assured that those that have received the first dose will get the second dose at the appropriate time.
Thank you, Ms. Butler. Gilles Duval, CMT, Edmundston.
Oui, bonjour. Les questions que je voulais demander par rapport au cas à Edmundston ont été répondues par Dr. Russell, mais est-ce qu'on peut lui demander s'il y a de l'information ou confirmation comme quoi la possible contamination dont parle le réseau Vitalité pourrait être reliée au fait qu'il y a des patients qui sont hospitalisés pour la COVID à Edmundston depuis quelques jours?
Give him what you can.
OK. Alors, depuis le commencement de la conférence de presse, j'ai reçu des nouvelles sur la situation à Edmundston. Alors, je vais lire ce que j'ai reçu pendant la conférence de presse. Alors, je peux confirmer qu'il y a eu une éclosion déclarée aujourd'hui à l'hôpital régional d'Edmundston. Il y a 2 patients qui sont des cas dans les soins intensifs et on a 3 travailleurs de santé qui travaillent dans les soins intensifs et un patient qui était admis aussi aujourd'hui avec le COVID. Alors, on travaille ensemble avec le département de santé publique et Vitalité avec leur département de contrôle de l'infection et on fait les recherches et des enquêtes. Et Vitalité a suspendu les visitations except dans les soins palliatifs, maternité et pédiatriques. Et les patients avec des rendez-vous aujourd'hui peuvent venir, sauf qu'ils devraient suivre les directions de santé publique. Et comme j'avais dit avant, c'est pas suggéré de vous présenter à le département d'urgence à Edmundston, sauf que si c'est quelque chose de très urgent. Et il y aura plus de détails qui vont venir après.
Monsieur Duval, as-tu un suivi?
Oui, juste rapidement pour savoir, quand il y a des patients qui sont hospitalisés pour des cas de COVID, est-ce que c'est inévitable qu'il y ait une contamination parmi le personnel ou parfois ça peut être évité?
Chaque situation est différente. Dans les autres éclosions, dans d'autres endroits du province, on a vu que des fois, ça arrive que les gens sont soit des résidents, des patients, soit des gens qui travaillent avec les gens dans des institutions. Mais pour dire que c'est où que les cas ont venu, puis toutes les recherches qu'on fait pour l'enquête maintenant, j'ai pas des détails là-dessus. Je sais qu'il y a des possibilités sur des gens qui sont admis avec le COVID déjà, et il y a des cas où les travailleurs de santé sont infectés dans une autre façon. Alors, j'ai pas reçu toutes les informations sur l'enquête et les détails. On aura plus de détails plus tard.
Merci, Monsieur Duval. Jordan Gill.
Merci beaucoup.
CBC.
Yes, I guess this question's for Dr. Russell. Will people who opt not to get the vaccine be restricted from traveling, and will there be any sort of immunity passports for people who do get vaccinated?
So it's very early days at this point in terms of what types of restrictions will happen in the future. I can't really comment too much on that other than I'm aware those conversations are taking place. And I don't see anything different happening with respect to the public health measures that are in place right now. If other countries or airlines, et cetera, decide to impose different types of restrictions themselves, I'm not aware of that at this point in time. So certainly we will keep monitoring the situation and we'll keep listening for more information on that. But I don't have any other details at this time other than I'm aware those conversations have taken place.
Mr. Gill, do you have a follow-up?
Yes, I guess this is for whoever wants to answer. And PEI, the owner of a tuna processing facility, donated some of his large lab-approved freezers to the provincial government to store the Pfizer vaccine. The PEI government took him up on the offer, and he's making the same offer to the New Brunswick government. Will New Brunswick be taking him up on that offer, or is there an alternative plan in place?
Thank you for the question. We are aware of that offer, and it is being considered. As I mentioned earlier, we are inventorying all available, both freezers that will go to -20 and the ultra-low temperature freezers as well, of which this is one. We are going to acquire a few more details from the kind gentleman who made this offer, but it is our intention certainly to factor that into our considerations, and if we identify a need for it, we'll certainly be in direct communication with him about that very generous offer.
Thank you, Mr. MacCallum.
Thank you.
Thank you, Mr. Gill. You got two, right? Merci beaucoup tout le monde. Cela conclut la séance d'information d'aujourd'hui. Thank you, everybody. That concludes today's session.